You might have faced this problem. A filling pops out. A crown comes off. You break a tooth and you're nowhere near a dentist. What are you supposed to do? Well, more and more people are turning to do-it-yourself dentistry. Yes, you cringed too. On YouTube, we found more than 40,000 videos when we searched DIY dentistry. The Fox Medical team's Beth Galvin is here to talk about this trend. It kind of sounds like a bad idea. Joanne said earlier, oh my gosh, really, all I can see is like a pair of pliers that you're trying to stick in your mouth.
Exactly, it's hard for you to even say it.
Yes, it is.
Well, I think, there are a lot of factors at play here. In some cases, it's coming from cost or fear or desperation, or some people are just creative and they like finding their own fixes. And I found videos titled, and I have to read here for you, Cheap, Easy Braces Without Going to the Dentist, exclamation point. Another one is Wisdom Tooth Removal dash Do It Yourself. And Dr. Alex Rodriguez says there actually is a lot of good information out there, but there's also a lot of misinformation, and that can make this DIY dentistry dangerous. It's a sometimes alarming new trend popping up on YouTube. Do-it-yourself dentistry. People finding their own fixes for dental emergencies.
Usually the reason they're there is because the tooth is broken, it's got a big cavity in it, it's killing them, it's hurting them, they're desperate.
But Dr. Alan Rodriguez of Inman Dentistry says some of these videos are hard to watch.
There are videos online, people taking out their own teeth, people trying to do their own orthodontics, people trying to do their own fillings. I've seen people get pliers, there's videos of people getting vice grips on there, trying to pull that tooth out.
The problem?
Almost every case I've seen, they're not getting the whole tooth. And they think they've done a great job, but if you look at it, they've gotten a piece of it out. The root is still there, and there's a really big chance it's going to get infected. And if it gets infected and it gets severe infection, we could be talking an emergency room visit.
Another dental DIY tool, super glue, to replace missing fillings and crowns.
People resort to something else, and they're like, I got this crazy glue at home, let's just glue it in. And they try. If you're going to do that, I'd rather use something like Elmer's. Elmer's I can clean off. Crazy glue, I can't clean it off.
A better idea? Dr. Rodriguez says hit the drugstore for one of these over-the-counter dental repair kits. They can help you reseal a missing filling or crown, but start with a rinse.
Some mild, warm salt water is really great to swish around, try to get that little debris off of there. If it's not too sensitive, hit it with a toothbrush.
Then stick the tooth back together.
You make a little ball and you poke it in the hole and kind of bite down on it, and that's it.
That should hold you for about 48 hours, but then Dr. Rodriguez says let a pro take it from there. And if money is an issue, Dr. Rodriguez says there are some low-cost dental clinics available in the metro Atlanta area. He volunteers at the Ben Massell Dental Clinic in Midtown. Another large clinic is Good Samaritan, and that's on Donald L. Holloway Parkway. Both have waiting lists. Both have requirements that you have to meet in order to be a patient, like residency requirements, Gravere, but both can be an option if it's not a total emergency and you can wait a little while to get in.
Yes, sometimes you can wait on the fix, but gosh, that pain, is there any DIY fix for, alleviating some of that pain?
One thing that has been used for thousands of years is clove oil, applying that to, the tooth, the area that's aching. Another thing that works really well is just the over-the-counter pain medication, the ibuprofen, the acetaminophen, some of those Advil, Tylenol, things like that might be helpful.
I can tell you glue works really well on the bottom of my shoe when I step on it. Does it work just as well to fix a broken tooth or stick a crown back on?
Gum actually works pretty well. You do want to use sugar-free gum if you can, but if you're just looking for something, you don't have time to get to the drugstore and you've got to put that tooth back in place, just take a little wad of gum, put it in there, stick your tooth back in.
But
then get to the dentist. Really.
Exactly.
Don't let that go on and on and on. Yeah.
Thank you, Beth. I appreciate that. All right.